Hello, this is Daniel Wolfson from the ABIM Foundation. I'm joined by Don Bradley, MD, from the North Carolina Healthcare Quality Alliance. They're a grantee of the ABIM Foundation under the support of Robert Wood Johnson Foundation, and we're going to talk about a recent grant that they received from us. Welcome, Don.
Good to be here. Thanks for having me.
So give me a thumbnail sketch of the Alliance and what you do and what your objectives are at the Alliance.
Yeah, so the North Carolina Health Quality Alliance was actually founded as the governor's quality initiative back in 2006. Really, it's a very broad coalition of folks who are really interested in dramatically improving the healthcare and the health of North Carolinians. So that would be our mission, is just to improve both the healthcare and the health of all North Carolinians.
So what attracted you to the Choosing Wisely campaign?
So we've been at the North Carolina Health Quality Alliance has been around for 8 years. We've done a number of different projects, from supporting improvement in primary care practices to developing a health quality atlas in the state, supporting some research. And the Choosing Wisely project really hit a number of our sweet spots. One was to work in a project that required collaboration from across a full spectrum of stakeholders. And second is that it really is a worthwhile quality improvement effort. And then finally, the ABIM and Consumer Reports have a tremendous infrastructure to help support the work. So it seemed like a great fit for the things that we think are important.
So what is your general approach to increase awareness of Choosing Wisely throughout North Carolina? And specifically, what are the interventions that the delivery sites will be using to decrease utilization and attain the goal of 25% reduction in use?
So we're partnering with two great health systems from really different parts of the state, the Duke Health System and the Cornerstone Health System. And we're doing some provider education kinds of things, very specifically lunch and learns, kind of the typical things, providing the kinds of materials that practices can use with their patients to improve it. We're also working on putting some markers in the electronic health records. And clearly the North Carolina Health Quality Alliance doesn't do that, but working with the health systems to get that done. And then we also work on the consumer side. So our partners at the State Health Plan and Blue Cross Blue Shield are working with us to get materials out through their various ways of touching folks, and to get information out that way. So those are kind of the keys at the moment.
So what are your biggest challenges, and how do you plan to overcome some of those barriers to make your program successful?
Yeah, I think there are two key challenges that we've run up against. One is really just defining the metrics appropriately. Each health system has kind of got their own way of measuring things, and we're trying to build some consistency among them. And then making sure we've got the right data sources to collect. So that's kind of a data issue. The second key issue is around coordination. You know, for most of the folks who are working on this project, this is not their day job. So we're really needing to kind of remind folks and provide support so that they're getting things done. The other thing is that there are multiple kind of Choosing Wisely type efforts going on in the state. The Hospital Association, for instance, is running a bit of a program, and each of the health systems are doing so. That, while it's great to see providers working on that kind of stuff, it also can be confusing to members. So the other coordination piece is to be as member-centric or client-centric as possible, and to try to avoid confusion. The ways that we're dealing with that is that the North Carolina Health Quality Alliance, using the part of the funding from the ABIMF, is helping to coordinate those efforts to really encourage folks to coordinate their efforts so that they're not kind of hitting people from different angles. And then we're also using the larger North Carolina Health Quality Alliance to advocate for this project within their own constituencies. So we've got a couple large employer groups who have joined in our efforts, and then the Medical Society and the Hospital Association and so on.
So you've been at this for several months now, Don. Can you point to some success, some initiative that went well, that pushed the ball down the road a little bit?
Well, probably the most gratifying piece of this is just in announcing that we had gotten the grant. We've actually had one large health system in a completely different part of the state call in and say, well, we'd like to be a part of this as well. And our Medicaid program has also asked to join. So I think getting the message about choosing wisely out there, seeing that it's really being done as a quality initiative and not really aimed directly as a cost initiative, I think we're seeing some good excitement there.
So what does success look like to you, Don, in North Carolina? What would be a successful grant program after 3 years?
Yeah, I think there's obviously success would be reducing the unneeded services would be kind of the outcomes piece of it. But I also think building the number and level of collaborations and the amount of trust amongst organizations in and of itself is a real benefit to this kind of an effort.
So thank you so much, Don, for participating and telling us about what North Carolina Healthcare Quality Alliance is doing. It sounds really exciting, and you are teaming up with some really wonderful delivery systems that are advanced, and they're thinking about delivery systems that are a part of the 21st century. Thank you very much, and good luck.
Great. Thanks for having me.